Hello again. Welcome back to the Better Together podcast. I'm your host, Mike Baker. We're going to have a really powerful conversation today. We're meeting with Jonz and Jordan Hunter with the Alzheimer's Association. We lost my mom to Alzheimer's about 5-6 years ago, and this is a disease that it's a mean monster that robs futures. And so we're going to have a deep conversation, but we're going to end with hope. So stay tuned and pay attention to the things that you learn inside this podcast. Be active and work on the things that you learn here. So, all right, well, let's just get into it. All right, well, welcome to the show. Thank you for being here. This is going to be an episode that, it's near and dear to my heart. You know, we talked before we started shooting. You know, we lost my mom to early onset Alzheimer's about 5-6 years ago now. And it's devastating. It's really hard to watch somebody go through that journey. You know, she's still there. She's still my mom. She had that just shimmer in her eyes, and we knew she was there, and then there were times when she was gone. So I'm excited for this conversation. We need to just have more conversations about these types of things. So before we get into all that, tell us a little bit about yourselves, like how you got into this role and what you're doing with the Alzheimer's Association.
Yeah, so my name's Jonz. I'm the Eastern Washington and North Idaho program manager for the Alzheimer's Association. With my emphasis is care and support. So I do a lot of our outreach presentations, make sure that our caregiver support group, memory cafes, that they have trained facilitators to run those groups. And I've always been in social services since I graduated from college. Majority of my career has been spent kind of working with the developmentally disabled population. And I ended up getting, I think, a little burnt out. And I'd been in that probably 20 years. Mm-hmm. And so I wanted to remain in social services and just kind of pivoted to working with the Alzheimer's Association. I've been here about 2.5 years, and I just absolutely love it. It's been a really rewarding position.
That's great. What a great mission. How about you, Jordan?
I am Jordan Hunter. I am the development manager, and I cover the walked-in Alzheimer's here in Northern Idaho and over in Spokane and down in Lewiston. And the Walked-In Alzheimer's is an event that raises funds and awareness so that we can provide free support, education, services for those impacted. And I've been here for 5.5 years. I first came into understanding dementia and Alzheimer's with my best friend in high school whose father passed from early onset. And now I know many people who are both living with Alzheimer's and caring for someone with Alzheimer's. So it's become a personal thing for me.
Yeah, I mean, I find that, you know, I feel like all of us working in the nonprofits, like you do this because it matters. And I tell lots of people, you have sort of job, career, calling. Mm-hmm. You know, I mean, anyone can sort of go have a job, and career's good, but I mean, most of the people that are successful in working in nonprofits, it just becomes that calling. And, you know, you mentioned the relationships that you've built over time. I mean, you get to hear stories that, like, a lot of people just miss, you know, in life. And I think that's such a powerful thing for it. Is that something that just helps drive you to, you know, like get out of bed in the morning and go make a difference?
I think, I mean, I'm asked all the time, why do you do this? And everyone kind of assumes like I lost a parent or I lost a grandparent. I'm driven by wanting to make change and help others. And so nonprofit's always been my route, but being here and just seeing the lack of awareness and the stigma and that's going on around Alzheimer's and dementia, and how many people are truly being impacted by this and not talking about it. I've just become more passionate about wanting to just open people's eyes.
Right. You want to like shout it from the rooftops, right? Yeah.
Yeah, and I think that I made a conscious decision, I think, early in my career where I had to make a decision on what I wanted to focus on professionally. And it became really important to me that at the end of the day, you want to feel like you're having some sort of positive impact on the world, and your work is meaningful and it's making a difference in people's lives, that's what always led me into social services. And no doubt you get that from working for the Alzheimer's Association. So it's important work. And I think, speaking for Jordan and myself, I think we're both just honored to be able to be part of that message.
Yeah, you get to wake up and go make a difference every day. And so so as we talk about working in nonprofits and building relationships, I think it's just powerful learning the stories of people that we work with. As you're kind of, putting the walk together and as you guys are spreading awareness in the community, what are some of the favorite moments that you've had as, because you make connections and all of these things, but do you have some favorite moments you want to share?
For example, I was at an event last weekend at a booth, and typically when people see us and see our booth, it goes one or two ways. One, they want to come tell us a story, or two, they look at us and they're like, I don't want to talk to you. We're contagious. But I had this woman come up to me, and I talked to her about half hour, and she was taking care of her sister and asking for all this information. You could tell she was just so overwhelmed and had no idea what to do. And as she's walking away, she just stops and she looks up at the sky. She goes, can't believe they were here today. This was meant to be. And so it's experiences like that sometimes we'll go to health fairs or different events and no one shows or whatever, but we always have at least one powerful conversation that made it worth being there. And it's just so powerful to know that you can give some sort of relief to someone, because this is such a daunting disease that people get the diagnosis and then they're lost.
Yeah, that daunting and lonely and overwhelming. Yeah.
Isolating.
Yep.
Very much.
Yeah. How do you guys, when families start noticing something, what are the things that families can do to kind of prepare for this? Because not everything is Alzheimer's, thank goodness. Sometimes we're forgetting something and it happens. But as you walk through it, what are the things that families can be doing to prepare, for kind of entering this phase? I know we felt lost, with my family. My mom was a nurse, and we felt like we were pretty good at the healthcare system, but we felt so lost of what to expect and how to, plan and prepare for things.
Well, I think that, we work pretty diligently to make sure that we have built-in relationships with all of the medical providers so that hopefully they'll have Alzheimer's Association packets of information. But I think the main thing, at least that I do on my end, is we're really trying to increase our educational and awareness opportunities in the community. So the more people we can reach that understand the access that they can have to our education, our supports and resources, which being a nonprofit, it's totally free, provided to the community. So we're just trying to really, again, expand the number of people that we're able to get that information to, so that when they are faced with a potential health crisis in their family, they know what to do. They know who to contact. They know what might be available to them in the community.
That's great.
And I think too, when, for families, when they're getting that diagnosis, for one, yes, to call the Alzheimer's Association. We have our free 1-800 number, and it's a resource line that they can connect and ask questions. But also, making a plan. Well, that person can still be a part of it to make the plan. Advocating for your loved one is huge, and people are so lucky when they do have that person or those family members to advocate for them. And finding out what resources are available and what's in the community, what options you have.
Oh, that's great.
And I think really quickly too, and this is just to put a finer point on it, because I don't think we can necessarily oversell this, but when we talk about people don't want to talk to the Alzheimer's Association, I'm talking they'll see our table at a health fair and it'll be like it's the plague, and they won't make eye contact. They'll do anything to avoid engaging our table. And so one of the things we really, really fight with is making sure we're just trying to reduce the stigma, where people are more comfortable talking about it and engaging the topic, because especially the more rural you get, it's an even harder conversation to have, and less people are inclined to want to talk to us. So that's just a constant battle for us, is making sure that people get comfortable having those conversations within their families, the communities, because if we can't educate them, then it's going to be a real uphill battle.
Yeah, I mean, that's such a great point to talk about the stigma related to this thing. I mean, this is a scary, evil monster that takes families away from people, from each other. I think, for many years, mental health really had that same thing. And I don't know that we're perfect about it now, but
Yeah.
I think what we learned was let's talk about it. Like, let's just really increase that awareness. So let's talk about that for a minute.
Yeah, I think the one word with this disease right now, I would say for so many families is it's isolating because they're not talking about it with anyone, or you meet someone that was diagnosed and they'll like whisper, "Oh, I have Alzheimer's," like they're ashamed, like they did it to themselves, and that's just so not the case. And I think too, it's this older generation with such pride, and so they don't want someone to think, all I've worked for my whole life, I'm that's going away. And so they'll hold on to it and not want to talk about it. And so for just the community and for everyone to understand the disease and be educated about it could be so helpful, and to understand that this person isn't their diagnosis. It's something that they are living with, but they are still that person. So, from the outside too, when you hear someone has Alzheimer's, you don't step back or get scared or
Right.
avoid the table. It's okay. It's a part of life, and statistically happening to so many people that we need to talk about it.
And it's not contagious.
Right.
You can't get it from sharing a coffee.
Right. Walking up to our
Right.
table.
I mean, give people hugs. I mean, I just remember, my mom feeling lost and, family feeling lost in that situation. And we did talk about it as family, and I think that helped. But just kind of people's reactions, like when my mom would lose train of thought, or if she would repeat something, sometimes there's this desire to go in and like try to, well, hey, you already said that. We're like, it's fine, we're good. You just keep rolling with those conversations, but really increasing the awareness, because I mean, the goal here is early detection, prevention, as much of that as we can do. And if we hide it and if we don't talk about it, you can't start early because you don't get tested and you're not ready to go. Like we have to do this better.
Yeah.
And I think there's a huge pushback to the idea of early detection. So we run into this all the time. And so people they'll tell us, why would I want to get early detection on Alzheimer's? If there's not a cure, what's the point? Why would I want to know what benefit is to getting that diagnosis? And I think to Jordan's point, and what I tell them is like, that's a very personal decision that somebody has to make. But I would want to know, because I'd want to be able to create the healthcare support team around me. What services and supports do I want or need, right? You want to be able to put your estate in order. And plus, the other thing is the earlier detection that happens, there's all sorts of new medications that are available now to treat symptomology. And so the earlier you get that diagnosed, the earlier you can get on medication to manage your symptoms. So there's all sorts of reasons why early detection is important.
And we do all these things to extend life. And that's what the healthcare system is about. And we don't have a cure for this yet. But there are promising medications. I mean, there are things that are giving even a few extra good years.
Right.
We need to take that as much as we can. And again, I think, it's just back to that early diagnosis and early conversations about it. And
I would say that's the biggest thing that we get pushback on is, well, I don't want to know.
Yeah.
I think, I don't want to know either, but just think of the change it can make for you and for your whole family. So it's not something that's happening to you. Like, you have more control over it when you have an understanding and education and support system and a plan in place. And you can say how you want to progress in this disease, where you want to live, how you want. There's just so much more power. You can take power in it with that early diagnosis.
I always think back to the movies of the small kid that's fighting the monster, right? I mean, it's scary as hell to walk through these things and see it, but you have to have that bravery to say, okay, I am staring down this monster and it's coming for me. I'm going to fight it as long as I can, right? We're going to do all those things. But the more that we can, assemble a team around us, that's important. It's a lot of work on caregivers and family and support systems around. And I think you need to also prepare for that. It's almost, kind of, sometimes people need a reason to do something, you know? And so it's like, okay, well, if I know that if I get early detection and I know what's coming, I can actually help my family deal with it better. I mean,
Yeah.
sometimes that's the thing people need is to say, you get past yourself, we're going to
Yeah.
worry about that. But if my actions then help my family be better prepared, you know, maybe that's another way for people to think about it.
100%.
Well, and I mean, talking about early detection, because this is something that, again, that is fairly new and fairly recent. It's pretty game-changing when it comes to Alzheimer's, getting diagnosed with Alzheimer's. So there's now a blood test that's available that can actually diagnose Alzheimer's before you're actively showing symptoms of Alzheimer's. And so, I mean, this is kind of revolutionary for the healthcare system. What we're really trying to work with at this point, because it was just FDA approved last year, so now it's the ASAP Act is what it's called. It's the Alzheimer's Screening and Prevention Act.
Okay.
And what we're wanting to do is get quite a few co-sponsors by legislators to get this bill passed where Medicare would pay for this screening. Currently, Medicare does not. So what we're kind of relating it to is similarly a mammogram for breast cancer, right? Medicare covers that as a screening, and we want the same thing to happen with this blood-borne test for Alzheimer's, which again, they used to have to do through a spinal tap or a brain imaging, you know. So the fact that it's like over 90% accurate through a blood test before you're showing symptoms, again, is kind of revolutionary.
Yeah.
So if people are interested, we just ask that they contact their local legislator and just let them know, please pass the ASAP Act. Because if we could get Medicare to cover this screening, because when you think about it, we're talking about if somebody could get on symptom-reducing medication before they're even showing symptoms,
Yeah.
You might be able to buy them multiple years of cognitive health before symptoms would get really severe.
No, it's a big deal.
Yeah.
I mean, you know, again, what would you do for 5 extra years or, you know, whatever it ends up being, right? Like, you know, this thing's coming. Let's get in front of it. You know, there are lots of things that you can do to sort of stall it, delay it. I mean, take as much time with those memories. And then, you know, we talked as a family, you know, we knew this was coming, and my parents were so great about creating memories for everybody around, right? And I talk about, you know, I may not know what happened yesterday, but I remember all the things before that. And so, you know, if this happens to me and I'm laying on that bed and you see me smiling, I'm thinking about some really great memory that happened a long time ago. And I saw that with my mom. You know, they were very intentional about bringing family together. We did a few trips. They came up here to the Hiawatha Trail.
Oh, nice.
And the first year my mom did it was before she was diagnosed, but she fell in the tunnel and like broke her arm. It was rough. But then she always had this fear of doing it. But one of her things was, I have to do the tunnel before I'm gone. And so my dad bought this, like, they came up a couple years later. He had bought sort of a trike bike, and then we put lights all around, and the family was there. And we're all with her, you know, going through the tunnel. The grandkids are there. And at the end of the tunnel, you know, the grandkids went forward, but they were there. And they're just like, Grandma, you made it. And blah, blah, blah. I mean, it was like the most emotional thing to just have my mom sort of, in essence, tackle that demon. And then you go to the light at the end of the tunnel, and the family's there. I mean, it was one of the most powerful moments. But when you get this diagnosis, like, you have to start building those things. I mean, that's the stuff that matters as you make those connections. I mean, build relationships, build those memories. They don't have to be thousands of dollars of trips and all those things. Like, a Sunday dinner can be some of the best memories that people have. But I think that's what you get when you understand the monster that you're facing, the early awareness. And I think you can prepare and build for that. And we don't actually know what tomorrow's going to bring, any of us.
Right.
Right?
Yep.
And that's, I mean, having relationships. I have a couple girlfriends who are living with early onset that I've met through this and love very much. And it's being a mom of young kids myself, and having a relationship with them living with early onset, I've learned so much that it's just the little things with your family and your loved ones in life that are so important. And, you know, it's one of those things, like, we think we'll live forever and whatever, but it's just so simple. It's just enjoying and making memories with who you love and and not taking it for granted.
I think that's why it's so scary for people to talk about it, right? I mean, I don't want to know that tomorrow
Right.
my life's going to change, but there's also power in that knowledge. And I think, again, the more we talk about it, the easier we make for people, that's a big deal. So you guys talked about, you've done some training with the residents here at Heritage Health recently, which is really fun. Talk a little bit about what you're telling primary care providers. What are some of the trainings? How can the primary care folks that listen to this show, what do they need to know? How can we learn more?
Yeah, so I mean, regarding outreach, we have a variety of educational and awareness presentations kind of directly related to Alzheimer's and dementia. Just really quickly, because this question often comes up, the distinction between Alzheimer's and dementia.
Yeah.
So again, dementia is that's the large umbrella term. Alzheimer's is the most common type. It's why you hear about Alzheimer's more often. And typically, I think at this point, if people go in and get a dementia diagnosis, about 70% of them are Alzheimer's. That's why we hear about that the most. But there are also multiple other kinds of dementias. And so, what was the question?
That's great.
Providers.
Yeah, talking about the
Yes.
trainings for providers. Yeah,
Cut this part
yeah,
out.
that's right.
So we work really hard to make sure that, like, when I go talk, like, to Heritage Health, I will work with whoever is setting up that presentation to determine what's the information that we currently have that would best benefit the specific audience. And one of the things that we're really focused on now is brain health. So, I mean, we still have presentations on 10 warning signs of Alzheimer's, understanding Alzheimer's, but there was a huge study that came out a couple years ago called the U.S. Pointer Study, which was financed by the Alzheimer's Association, and it was one of the first multi-level research studies that actually showed evidence that focusing on these specific brain health risk factors can decrease the potential likelihood of getting Alzheimer's. It was some pretty revolutionary results.
Yeah, it's powerful.
So a lot of what we do now is, and we had talked a little bit about the Brain Health at Work program, is we want people, look, it's a heavy, serious topic talking about Alzheimer's. And so what we want people to kind of leave our presentation with or talking to us is there are things that they can actually positively impact regarding their own brain health. So we want them to leave with, if I focus on these things constantly, then I'm going to have a better chance of reducing my chance of having Alzheimer's or dementia. Even again, if we start talking about, like Jordan had mentioned, if you're able to buy yourself 2, 3, 4 years of cognitive health because you've really focused on your brain health, and if anybody's ever been around a loved one with Alzheimer's and you ask them, well, would you want 4 additional years with that person where they had positive cognitive abilities? So that's why I think brain health is a big focus for us. And if you go on our website, alz.org, it'll give you the U.S. Pointer recipe where it literally breaks down the specifics you need to focus on when it comes to nutrition, cardiovascular exercise, cognitive exercise. It'll tell you exactly what you need to focus on to yield the best results when it comes to brain health. So that's a big focus for us right now.
Huge, right? I mean, again, in primary care, we want to help people live longer. Our mission is to improve life, right? And so eat better, exercise, be outside, don't isolate. I mean, there's a lot of things that just are in common with all of these factors. We talk about heart health and brain health, and
Right.
like you dial it down and take it back just a little bit further. We just don't take care of ourselves very well. And I think, overall, if we could just everybody slow down just a little bit and, connect with other humans, kind of build those relationships. I mean, there's power in that. And I think that is a big part of why we're seeing so many of these conditions just really explode. I think you look at the way that we're living our lives and the outcomes, it's pretty easy to match up and say, well, we stopped eating well, we stopped connecting. Those types of things are really important. So that's great.
And I think the one thing that's interesting about the Pointer study, just really quickly, is that if you take like the individual pieces of the Pointer study, we've all been told these particular things what we need to do to remain healthy. So the thing that's unique, I think, about the Pointer study is it gives you specifics of how, for you to have the best possible results, you need to do all of these combined And so the recipe itself specifically tells you how much cardiovascular exercise you're supposed to get, and what your nutrition needs to look like. But it's designed to be done in conjunction with each other, all of
That's
these
great.
levels. And so that's where the improvement really comes. And that's why the study itself was so important, was to be able to give people a specific recipe that they can follow that will target brain health.
That's
So-
great.
I think what's cool too about the Pointer study is it's showing that you can start this at any age. So for so long, Alzheimer's and dementia is just like this looming fear of when you get old. But this is something you can work on from day one. And so it's kind of bringing primary care into it, where you're not waiting to go to a neurologist to get a diagnosis. This is something you're doing in the span of your life to prevent it, which is great. And I know with primary care doctors, they're doing a lot of the diagnosis and seeing the Alzheimer's before a neurologist, because the lack of, I mean, the wait list is
For specialists,
it's
yeah.
insane, and so they're seeing it first. And so I think it's very important for these primary care doctors to know of the resources that we have in the community, know that the association is here, know of the community partners that they can then send their patients to, because I so often hear someone gets a diagnosis and then they don't know what to do.
Right.
And when you're hearing that first from the doctor, to be able to be told, but here's 10 pamphlets of things you can do and resources you can go, is huge. And that would be a big win for primary care doctors, all doctors across everywhere, to know that there are those resources and that they can send their patients to.
Yeah, it helps. I mean, you think the primary care doctors are somewhat the quarterbacks in the healthcare system, and they have to be really good at lots of things. And patients, this is one of the side for patients, for people that are listening, sometimes using the right words to describe your things. I mean, most of the providers are trained on algorithms of, symptoms, and like they said, they have a runny nose, and so I'm going to do X, Y, and Z, right? And sometimes for us, the training is just updating the algorithms that providers are trained on. But I think it's really important as patients to know, okay, here's some of the things, here's some ways to describe things so that you can sort of enter the algorithm space with providers and get on that right track. And sometimes that doesn't feel fair to say the patient has to, be more educated than the provider, and that's not what I'm saying. But as we have increased awareness in the community, we talk about it, it's like, well, hey, so my daughter has endometriosis, and it's another terrible, awful disease, right? But if you describe it differently, and sometimes you can catch providers in a way that makes sense, then you have a lot greater outcome, to get to where there's a positive result. But we just have to continue to train each other and talk about it and build it out. It is a scary monster, but we have to talk about those things, and I think that's how you take away that power.
Yeah, and that awareness and education. I mean,
Yep.
for example, one gal she's turning 60 this year, she was diagnosed, but for the longest time they kept telling her, oh, it's hormonal or it's menopause. And so because you're looking at someone who's 55, healthy, she's a nurse, she's, a runner, it's not what they expect.
It
So
doesn't fit that pattern.
right.
Yeah.
And so you have to advocate for yourself, and you have to advocate for your loved ones. And so just in like the 10 warning signs that Sean is constantly educating the public about, it would be so helpful for just everyone to have in their pocket. We have a good bookmark.
Yeah.
If everyone could just see it, and once you see a couple things on it, it clicks.
That's great.
Well, and I think the other thing too, kind of to circle back just to the blood test, this is why the role, especially of the primary care physician, I think will vastly change, is with the accessibility now of a blood test that can diagnose Alzheimer's. A lot of people, right, they still are laser locked in on the fact that they have to see a neurologist, right? The process has to run through a neurologist for the Alzheimer's diagnosis to be like actually valid.
Right.
And so to get not just the general public, but primary care physicians, healthcare professionals that maybe aren't totally educated on what that blood test is and how the results are so accurate, because now people can just request from their primary care physician the blood test. And I just presented a couple days ago and was chatting with a family after the presentation, and so the gal and her mom were at the presentation, and they had just done the blood test for the mom, and it came back positive for Alzheimer's, and it was 100% covered by insurance. So with the ASAP Act, we're trying to get Medicare to cover it, but there are a lot of private insurances that cover that blood test now. So I would just recommend families to check with your insurance if you're interested or needing that blood test.
Oh, that's great. Yeah, I'm sitting here going, oh, I should probably go get that test done, right?
Yeah.
I mean, and I think it's just such an interesting concept for all of us to grapple with, right? Like, okay, we can figure it, we can know things, and we can follow the recipe, for living a better life. We can do all those things, and like, I get it when people don't want to know the answer. Like, I saw what this did to my mom, and like, there's a part of me that's like, that's probably in my future, so I want to do everything I can. But then there's just this reluctance of like, well, once I know, I know.
Yeah.
It's hard to go back from that, right?
Yeah.
It's
Yeah,
tough.
it's scary. So this is it's a great conversation. I love to end on hope, and I know hope is sometimes a hard thing to connect with such a scary disease. But what gives you guys hope as you look out at the future, the next 5 years, the next even day sometimes at work? Like, what's giving you hope about this disease or the way we're handling it? I mean, how do you talk to somebody and just help them feel better about where they're going?
Yeah.
Well, I mean, I think when it comes to hope, I just think we see constant examples of that daily, especially if you start talking about our caregiver support groups. So we have a variety of caregiver support groups that we offer. And to watch caregivers helping each other through this journey, because oftentimes, if you can hear somebody that has a similar lived experience to you, I mean, our caregiver support groups are kind of magical places to watch them interact and love each other kind of unconditionally. And then also just to see some of our educational and awareness events in the community just grow, to see how much kind of voracious appetite there is for getting educated and understanding, and just watching the more educated that a community gets regarding Alzheimer's, then it just makes them more equipped to be able to handle a family diagnosis or helping a neighbor with a diagnosis or a church member. So, I mean, I just think day to day, there's all sorts of things that bring you hope, for sure.
I think, too, just being here for 5 years, working for the association, the amount of progress we've made in 5 years. I mean, it's wild how much, and last I heard, we have 200 drugs in the pipeline. So it's, the researchers across the globe are doing so much, and we're propelling forward faster and faster, which is great to know that, when my kids grow up, I hope this is something that is in the past and they can talk about, it was something that was cured. A cure is, I think, finally realistic to say in our future. I think for the longest time that was not the case, and now it's, it's not crazy to say. I think also with hope, I'm very lucky with my event that I do every year with the walk. It's a day that brings such joy in the community together over something that is so scary. I always quote this sweet old woman, she's 90, who's taking care of her husband. He's now in memory care, and she's like, Alzheimer's is just so sad, and this day was so happy. And so I think it shows how important it is to bring the community together and bring people together going through the same thing, and how powerful that can be. And so every year I always say at the fun side of it, because I'm trying to raise money and get people involved and excited to come do an event. But I think that event is really powerful to show people that they're not alone.
Yeah. Well, and I think that's just sort of part of the human condition. When we isolate and we're alone, I mean, it doesn't work. But there's a whole world out there ready to wrap their arms around you, wherever you're at in this journey. And just knowing that, okay, as a caregiver, there are people that I can talk to, and they understand what it's like to watch your wife disappear and be mad and frustrated at all of that. And none of it is at her, it is at the disease. And how do you place that? And how do you separate it between the caregiving duties and this is my wife? We've been, they were married for over 50 years. I mean, it was this thing. And like, I still see that anger in my dad now of like, we were robbed of this future. Yeah. And then, you look at that and just tying it to hope, like, what made it work for our family was we did come together. We were there when my mom passed. I mean, there were all of these moments where, we lost our mom, but the best part of my mom just lives in all of us today. And I think those are the lessons that we have to work on. I'm so grateful for you guys for the work that you're doing. You know, we look at the healthcare space here in North Idaho. I mean, our goal here again is just we want to make sure everybody has the best chance at living the best life possible. You know, looking at the testing, bringing support in. I mean, those are the things that, you know, we are really excited about working with. And I'm excited about the walk this year. Let's talk about the walk before we wrap up here.
Yeah. So we call the North Idaho Walk, is September 26th, and we hold it at Riverstone Park at the amphitheater. So it's a free event to join. It's a peer-to-peer fundraiser. So we look for people to fundraise, donate, corporate partners, but I also like to stress it's very much a free event. We want everyone is welcome. We want anyone and everyone to come that is looking for support, resources, community, more understanding. And so it's a morning ceremony that's always beautiful. We have a promise garden with pinwheel flowers that have different meanings, and they represent those that are going through the journey in different ways. And then the walk is just along the Centennial, along the river for 2 miles. And we have been blessed, knock on wood, with a beautiful day for the past 5 years that I've had it. And so we would love to have anyone come. act.alz.org/CDA. You can register, or just Google Coeur d'Alene North Idaho Walk.
That's great. And we'll make sure we put all the information in the show notes. We'll put the link to the 10 things we should be watching for and the recipe, so you guys can send us those links after. You know, for everybody that's watching, take this seriously. You know, like you're sitting here watching me sort of embrace my mortality about this test. It's real. I mean, this is a real thing. But I think, you know, again, the more information we have, the better. My Facebook algorithm's all about these crazy things happening in other countries with sound waves and da-da-da. And so I find myself having conversation with ChatGPT. We're like, how can I build that tool? And let's try it. Let's go, right? I mean, we all want to find this magic bullet that solves it. But I agree with you. I think with the AI technology, with the focus that's happening there, I do believe that a cure is coming. I hope that it's sooner and I get to benefit from that. Or I don't, you know, as we go through it. But I hope that, you know, as a society, we just keep coming together. But it takes all of us working together. So.
And one thing I would say about that, and this is another thing that people who are watching or who are passionate about Alzheimer's dementia, is that just the more that you can talk to your local representatives, especially when it comes to Alzheimer's research, the more research we do, the closer we will get to a cure. But we have to make sure that that research stays intact and that there's funding for research. And so the more that we can be in contact with our local representatives, just to make sure that funding stays in place, to make sure that research happens, the closer that we're going to ultimately get to a cure. So
that's great. Well, thank you for being here today. This is a great conversation. Again, near and dear to my heart. And I think we should end just thanking all of the caregivers out there, like my dad, you know, and my Aunt Kathy. I mean, there are these people that were just there for my mom, and I know you guys see that. So I think we need to be grateful for the caregivers, and big shout out to them.
The weight on the caregivers is heavy.
Yeah,
Absolutely. We see you, and ask for help.
Yes, please
ask for help.
Ask for
You're
help.
not alone.
You're
Please
not alone.
ask for help.
It's true. Well, great. Well, thanks for being here today, and we'll see you guys next week.